So, but what does the data tell us? So an older study in the 1980s studied US white males, veterinarians who died from 1947 to 1977, and they found that the proportionate mortality from suicide was 1.7 times higher than that of the general US population. However, when considering the topic of suicide, we need to consider how the profession has changed over the years. So it used to be that males, the profession was comprised predominantly of males who specialized in food animals. However, now the profession is comprised predominantly of females who specialize in companion animals. And with the U.S. veterinary school population being over 80% female, the number of female veterinarians will continue to rise. So it's therefore important to consider more current data with respect to suicide. And while previous suicide data among U.S. veterinarians were dated and limited to white males, we recently learned a lot about how many veterinarians are potentially at risk of suicide. So according to a 2014 survey that we did that involved over 11,600 veterinarians, we found 1 in 6 had contemplated suicide since leaving veterinary school. And equally as troubling, about 1 in 11 of those who responded to the survey were experiencing current serious psychological distress at the time of the survey. So we then followed up with another study that was published in January 2019. They analyzed the deaths of U.S. veterinarians who died during 1979 through 2015. And of the 11,620 deaths, we detected 398, or 3%, who had died of the decedents who had died from suicide. And in that study, we found that males were 2.1 times as likely, and females were 3.5 times as likely to die from suicide compared with the general population. And we actually, in that study, we also learned a lot about, we learned from the codes on the death certificates about how those people died. And so when we compared the method of suicide between the general US population and the veterinarians in our analysis, there were actually notable differences. In the general population, firearms were the most commonly used method. And in the study population, firearms were still the most commonly used method, but poisonings were higher than that of the general population. There were also some notable differences between male and female veterinarians in our analysis. So 51% of male veterinarians used firearms and 32% used poisoning, compared with 18% of female veterinarians who used firearms and 64% who used poisoning. And this analysis left us with some remaining questions. First, would stronger statistical methods confirm our previous findings? Second, what were some of the details surrounding these poisoning deaths? And third, were there work-related factors that contributed to these suicides? And finally, were other veterinary professionals at a similarly high risk of suicide? So to address some of these questions, we undertook a research project that we just published in the September 1 issue of the Journal of the American Veterinary Medical Association. We analyzed data from the National Violent Death Reporting System, or NVDRS. The NVDRS is a state-based surveillance system developed by the U.S. Centers for Disease Control and Prevention. And it compiles facts about violent deaths, and these are deaths from homicide, suicide, and deaths of undetermined intent. And they collect data from medical examiners, coroners, law enforcement, crime labs, and death certificates. The data is largely in free text, and it is a substantial amount of data. And we analyzed data for 2003 through 2014 from 18 states. This analysis included veterinarians, veterinary technicians, and veterinary assistants and laboratory animal caretakers. And of note, this was the first study that has assessed U.S. Veterinary technicians and veterinary assistants with respect to suicide. And we were also able to calculate standardized mortality ratios, which are a stronger statistical technique. And this data set allowed for looking at the circumstances surrounding each death. So the NVDRS began collecting data in 2002 from 6 states and continued adding states in the years since, so that now all 50 states are represented. However, because our data analysis was limited, it was limited to only 32 states. And I should note that 4 states with large populations were not included in our analysis, namely California, Florida, New York, and Texas. So the aims of our study were to first analyze suicides for veterinarians, veterinary technicians, and veterinary assistants and laboratory animal caretakers. Second, determine standardized mortality ratios for each professional category. Third, characterize the suicide methods used by veterinary professionals. And finally, identify job-related and financial problems that led up to suicide. So we started our analysis with over 205,000 records. That's a lot of records. We then, and each record has over 600 variables that are coded by state data abstractors. So again, this is a lot of data. Example fields from the data set include industry text, occupation current text, and occupation text. From there, we used an Excel macro and a comprehensive listing of keywords to select decedents who died of suicide and undetermined intent and likely worked as a veterinary professional. This resulted in the identification of over 27,000 records. The remaining 27,034 records were reviewed independently by 2 graduate research assistants, God bless them, for the purpose of excluding decedents who had occupations not relevant to this study. So this led to 776 records. And I should note the 2 graduate research assistants had excellent inter-observer reliability with a CAPA score of 0.89. Tracy Whitty, who was the principal investigator at Auburn University, and I then worked to resolve any remaining disagreements through consensus. And we ended up with 202 records. The decedents represented by those 202 records included 73 veterinarians, 77 veterinary technicians, 39 veterinary assistants and laboratory animal caretakers, 8 unspecified veterinary professionals, and 5 veterinary students. And when we examine the key demographics for these 3 professional categories, with veterinarians shown in the orange, veterinary technicians in the purple, and veterinary assistants and laboratory animal caretakers in the blue, we see that veterinarians were more often male, veterinarians and veterinary technicians were more often white, veterinarians most commonly died at an older age than did the other professional groups, and a majority of veterinarians and veterinary technicians were employed at the time of death. I should note this data set has strict reporting requirements, and so we're not able to report data for the veterinary assistants because of data suppression. Both male and female veterinarians had significantly higher standardized mortality from suicide than that of the general U.S. population. Males were 1.6 times as likely, and females were 2.4 times as likely to die from suicide. Likewise, both male and female veterinary technicians were also more likely to die from suicide, with males being 5.0 times as likely and females 2.3 times as likely to die from suicide. I should mention that the wide confidence intervals for male veterinary technician makes these estimates less reliable. In contrast to the other professions, male and female veterinary assistants and laboratory animal caretakers did not have significantly higher standardized mortality from suicide. When we examine death-related variables, we see the majority of decedents were injured at home. Nearly 1/2 of veterinarian and veterinary technician decedents died from poisoning. 1/4 of veterinarian decedents died from pentobarbital poisoning, and as we know, pentobarbital is the principal drug used for animal euthanasia. And veterinarians were more likely than the other professional groups to die from pentobarbital poisoning. About 1 in 5 veterinary technicians died from opioid poisoning, and veterinary technicians were more likely than veterinarians to die from opioid poisoning. Okay, so if we take the 73 veterinarians in our study population, we see that 34 died from poisonings as indicated in the blue. Of those 34 veterinarians who died from poisonings, 18 died from pentobarbital poisoning. Of the 18 decedents who died from pentobarbital poisoning, 13 or 72% died at home, thus indicating pentobarbital was taken from a clinic setting and administered in a home setting. So if we return to our figure which depicted standardized mortality ratios for male and female veterinarians, we see that if we remove the decedents from our analysis who died from pentobarbital poisoning, we find the suicide mortality for both male and female veterinarians is not statistically different than that of the general population. And in fact, there's limited evidence to suggest that if you remove a particular method used for suicide, that those who are contemplating suicide will not choose another method as a means of substitution. And in the case of veterinarians, if they do choose another method, it's quite possible that that other method would be less lethal than pentobarbital. So, all that to say is if we can do a better job of controlling, placing administrative controls on pentobarbital, it's possible that veterinarians would not be able to take the pentobarbital from a professional setting to a home setting to die from suicide. Okay, moving on to psychosocial variables. When we examine psychosocial variables associated with these suicides, we see that veterinarians were less likely than the other groups to have a history of a suicide attempt. And this is consistent with past studies and likely indicates that veterinarians are more likely to die on their first attempt, again, perhaps due to the access and knowledge about highly lethal means like pentobarbital. About 1/4 to 1/3 of decedents had disclosed their suicide intent. About 1/3 to 1/2 of decedents were undergoing treatment for mental health conditions or substance abuse less than 2 months before their death. About 1 in 5 veterinarians and veterinary technicians had a contributing job problem. And relatively few veterinarians and veterinary technicians had a contributing financial problem. So in summary, this analysis confirmed the high rate of suicide among US male and female veterinarians. And we also showed that pentobarbital poisonings at home were a substantial contributor to veterinarian suicides. And this is of note, this was the first study to establish a high rate of suicide among US male and female veterinary technicians. And finally, about 1 in 5 veterinarians and veterinary technicians had a contributing job problem before suicide. So this study was subject to several limitations. The first is we used a white, non-Hispanic population group as our comparison for suicide rates, and it's well known that white non-Hispanics have among the highest suicide rates as other groups, which meant we could have underestimated our suicide rate. Second, the degree of data completeness might vary among and between states, which could impact our findings. Third, it was often difficult to ascertain whether the person was currently employed at the time of their death in this data set. And finally, the proportion of males and females in each profession were based on survey estimates, and those survey estimates could lead to different estimates for our standardized mortality ratios. But based on our findings, we offer 3 key recommendations. The first is we need to ensure suicide prevention activities are targeted to all veterinary professionals and not just veterinarians. The second is, in partnership with the veterinary community, is to improve administrative controls for pentobarbital so they're not able to be accessed for suicide. And third, we need to use these data as a baseline for later analysis of the same data set to assess the effectiveness of suicide prevention activities. Unfortunately, recent headlines reaffirm the need for further research. There's definitely more work to do, and I know everybody in this room knows that. So we at NIOSH are pursuing further research in this area. We recently received intramural grant funds to conduct 2 separate studies. The first study we intend to conduct is a formal program evaluation of 2 veterinarian well-being initiatives. One is administered through the VIN Foundation and is called Vets for Vets, and the second is through the American Veterinary Medical Association. And we also intend to complete a case control study so we can assess work-related factors that contributed to suicide. And the way we want to compare 2 groups. One is a group of veterinarians who have survived a suicide attempt with a group of veterinarians who have considered but not attempted suicide. And I want to thank all the people who have contributed to these studies over the years, in particular Tracy Whitty, who's the principal investigator for this most recent work. Thank you.